My name is Olivia Bush. I'm the lead for the project that I'm going to be telling you about, which is a series of discussions on sustainable healthcare, and I'm the clinical program director at the Centre for Sustainable Healthcare. So, just to give you a background to the series, this is the second of 4 virtual events. Really, obviously, looking at in the context of new policy, I suppose, regarding net zero in the NHS. Obviously, this was published in October 2020. So this is part of an awareness raising campaign and sort of getting people to collaborate, an opportunity to get people together for future collaborations and action. And I just wanted to introduce you to a few concepts. So a lot of the work we do about changing and generating action is integrating sustainability into quality improvement, recognizing that quality improvement is a key mechanism for change in the NHS. The concept here is integrated in this way through the aim of sustainable QI. So we're aiming to deliver care in a way that maximizes positive health outcomes and avoids both financial waste and harmful environmental impacts, while adding social value at every opportunity. So that's in words. If we were to express it in terms of health economics in an equation, sustainable value would look something like this, where you'd have the outcomes for patients and populations, which is our aim at the top there. And then we think about the impacts or costs at the bottom. And here, because we're looking at, as part of sustainable value, we're looking at environmental, social, and financial impacts, which can be known as the triple bottom line. And how this links to social prescribing here is obviously we're looking at, it's all about relationships, I suppose, relationships between those 3 areas, particularly looking at an assets-based model of social sustainability. So what do the individuals and communities have to draw on that will help them be resilient to difficult times and flourish in good times? And what's the relationship like with the environment around us? Is that supporting or draining our health? So that's broadly sustainable QI, and where we've got some links there. And really just thinking about nature-based therapies as supporting most aspects of whole person care. That's what I was thinking about when I sort of was developing this series, and I think it's nice to nicely illustrated by this graphic, looking at all the different aspects of whole person care, whether that's social, spiritual, physical health, and cognitive health, all those sort of different areas. And linking back again, just thinking when we're looking at solutions, we're just really linking back to our principles of sustainable healthcare. And I think that the social prescribing element really links really beautifully to the prevention side of things, whether that's primary, secondary, or tertiary prevention, not necessarily just preventing disease, but preventing further worsening of disease. And also the elements around self-care and our relationship between patients and care providers, which I think Nick will talk a bit more about in a bit more detail. So the series is simply about, we were at the second of those, and we've already had one about remote consultations. So there are some resources available on our website if you wanted to go back and look at those. And we've got some up and coming ones. There'll be one on circular economy and likely responsible medicine stewardship, but we're also thinking about the possibility of doing one around Black Lives Matter and sustainable healthcare. So if you have any strong preferences and some suggestions, then let me know. You could make a difference to that. Just to say that we are funded by the Health Foundation and NHS England and Improvement very generously. And the bit of the aim of this of this series is to increase collaboration, as I mentioned, in the field. And this is going to happen through several ways, obviously events like this, but also we have a series of networks, one of which is the theme is green space and health. So I'd very much encourage you to join that. It's totally free, and start networking and asking questions of others, posting resources on that network. Love to have you. The other great network of people involved in quality improvement and health is the Q community, which is a health foundation initiative, which I found incredibly helpful myself for learning. And we do have a sustainable healthcare special interest group as well. So if you join Q, you can then join the special interest group. We'd love to have you there to contribute.